Imagine rushing your child to the nearest ER, only to find the hospital doors locked. This isn't a scene from a movie. This is happening right now in America. In 2025, rural hospitals across the United States are shutting down at a pace we've never seen before, and millions of Americans could soon have no place to go when their life is on the line.
Welcome to Bill Shock USA, exposing the hidden costs of American life, from medical bills to financial disasters. Subscribe now, because the next shocking truth is closer than you think.
In upstate New York, more than 25% of residents rely on Medicaid. Hospitals like Westfield Memorial and Schuyler Hospital are now at risk of closure because federal funding cuts are slashing their budgets. And this isn't just New York. California, Colorado, Texas, from coast to coast, the story is the same. Why? Because the system is designed backwards. For every doctor, there are 10 to 15 administrators draining money from the system. Hospitals aren't collapsing because doctors are expensive. They're collapsing because bureaucracy is.
In small towns, one hospital isn't just a hospital, it's the lifeline for the entire community. When Loma Linda University Medical Center or Victor Valley Global Medical Center are at risk, patients have to travel hours just to get basic care. Imagine having a stroke, and instead of 15 minutes, the nearest ER is 90 minutes away. That difference could mean life or death. In rural Colorado, nearly 25% of the community depends on Medicaid. But with cuts, Platte Valley Medical Center is already signaling layoffs and reduced services. The result? Families forced into medical debt, or worse, losing loved ones because of delays.
Here's the trend for 2025. Medicaid funding faces record-level cuts, while insurance premiums are expected to rise another 7 to 10% this year alone. Hospitals are caught in the middle. They can't afford to operate, and patients can't afford to pay. Some say the solution is universal healthcare. Others argue the government already fails to manage the system efficiently. But while politicians argue in Washington, hospitals are shutting down, and regular Americans are paying the price.
Even if you don't live in a rural area, you're not safe. When small hospitals close, big city hospitals get flooded with patients, pushing ER wait times from hours to days. We've already seen patients left waiting on gurneys in hallways. In some states, ER patients are waiting 2 to 3 days for a bed. This isn't a future problem. It's happening right now. And in 2025, unless something changes, it will get worse.
So here's the bottom line. America's healthcare system is collapsing in slow motion. Rural hospitals are the first domino to fall, but the chain reaction will hit everyone. If you believe healthcare should be affordable, and that no family should lose someone because the hospital was too far or too broke to help, then subscribe to Bill Shock USA. We uncover the hidden costs of American life, and trust me, the next Bill Shock story will leave you stunned. Hit that subscribe button and share this video because people need to know what's coming.